Welcome back YouTubers to my channel for Everyday Life with an Aspie. If you're following me right now, I'm AspieAnswersAll, or I'm known as now by many of you as Aspie. I'm all about creating mental health and awareness versus sharing my life stories with suspicious syndrome in everyday life conditions basically. I also talk about how to manage and treat these everyday situations that we face in our everyday lives, regardless if it's anxiety, panic attacks and all that, because I'm raising mental health and awareness as much as I can for every other, pre-diagnostic condition besides my area of suspicious syndrome. So bear in mind with some of the tips and advice is just based on my everyday life training and life experiences, and if some of it doesn't deem appropriate or fit to you, don't fret, just try and do some of these step by step, and if it still doesn't work, just basically just seek professional advice or seek an opinion. Not further ado, guys, basically also right now I'm all about doing basically beauty from ashes stuff as well, with the tips and advice or just messages of support is the right word I'm looking for, to support you guys as much as I can when you guys are struggling, just to let you guys know that you're not alone regardless what you may be facing. So not further ado, guys, basically this one's part 2 of the how to stop a panic attack. Basically I divided it into 2 parts, like most of these videos will be step by step, so it's easy for you to follow right now. So therefore obviously while I'm doing this, it should just be a continuation of the following part if you're following it step by step. So just to pull out a disclaimer out there before I begin this also, I'm no medical doctor, I'm just a normal everyday person that struggles with her own personal struggles of her suspicious syndrome and all that, but she's just trying her hardest just to share her advice, tips and whatever else and maybe help to manage and treat some of these conditions or whatever. But if you see any warning signs or symptoms of the ones that I'm sharing out of all these mental health series, do seek professional help, or for yourself, for your loved one, or even your friends basically. Also, feel free to just basically share these videos around that you may feel it is basically for that particular someone. So no further ado, guys, this one's part 2 of the how to stop a panic attack. This one's preventing future attacks, and hopefully we can learn something along the way between us. So, number 1, talk to your doctor about attacks. Obviously, your doctor is the first step to actually may be able to help you to treat you with the recommended medications, or may refer you further on to a mental health professional to evaluate and prescribe medications. Both a regular doctor and a mental health physician will likely recommend a cognitive behavioral therapist. My advice here is though panic attacks are commonly basically related to other underlying disorders, however, just to bear in mind, including some mental health conditions and some medical problems. Talk to your doctor to rule out of these underlying medical conditions. Number 2, seek medical help sooner rather than later. As we know, seeking help is better to do it first and foremost. So show that people that are treated for panic attacks and panic disorders early maybe have better overall outcome with fewer complications of their health later on in life. Number 3, take medications as prescribed for you. Commonly used agents include benzodiazepines, both rapid acting and intermediate acting. Like I said before, obviously when it comes down to it, it's with those ones that I've shared with you. My advice here, benzodiazepines are often considered as addictive, so to be sure to take them exactly as your doctor advised you to. Taking more than is recommended is dangerous and harmful and can cause serious potential fatal withdrawal effects if taken chronically and more. Number 4, take rapid acting agents only when needed also. Rapid acting agents help to manage the symptoms when you feel a panic attack is the start of it, and the signs for it. These often are prescribed to have available if needed or when you begin to have a panic attack. My advice here is to take these agents only when needed to avoid becoming tolerant to the prescribed dose. And number 2, examples of medications prescribed to take them when attack begins on as needed basis are your lorazepam, alprazolam, and diazepam. Number 5, take longer acting agents routinely or as prescribed. The intermediate agents take a little longer to start with but will have longer lasting effects. My advice here with this is these medications are often prescribed for routine dosing to help you avoid attacks until further steps are taken, such as your cognitive behavioral therapy that may be advised by your doctor or mental health professional. Your examples of your intermediate acting agents may include clonazepam, oxazepam, and chlordiazepam. Number 6, take an SSRI. Selective serotonin reuptake inhibitors, commonly known as SSRIs, are effective in treating panic attacks and your panic disorders. My advice here is SSRIs that are FDA approved, however, for the use in treating panic attack-like symptoms include fluoxetine, fluvoxamine, citalopram, escitalopram, paroxetine, and sertraline. Duloxetine is a closely related agent and is also approved for use in the treatment of the panic-like symptoms. Number 7, working with a cognitive behavioral therapist. This form of therapy is key in training, obviously, your brain and body to overcome your panic attacks or anything in general, and will help you reach to a point when you no longer will occur. My advice here is know what to expect from the cognitive behavioral therapy. Therapists trained in this area or form of psychotherapy use 5 fundamentals, and they work with people that suffer from panic attacks. These 5 areas of focus will include the following that I'm about to describe. Number 1, learning about the illness. This will help you better to understand what is happening that is causing the frightening symptoms that you're experiencing when a panic attack is occurring. Number 2, monitoring and recording dates and times of events, like keeping a diary or journal, helps both you and the therapist to identify the triggers that causes these attacks to begin. Number 3, breathing and relaxation techniques are a part of the tools used to reduce the severity of the symptoms. Number 4, rethinking is used to help alter the perception of an attack from what feels catastrophic to what is realistic. And last but not least, number 5, providing exposure safely in a controlled manner to places or events that are triggering for your attacks or are acting as triggers for your attacks to help train your brain and body to react differently to this. Number 8, consider an evaluation for the panic disorder. Panic disorders is diagnosed when 4 or more of the blood symptoms that I've addressed to you are present. Early treatment for panic disorders improves overall outcomes and reduces possible complications associated with the continuation of your attacks. However, basically, it's also important, regardless of it all, that we need to attack it when we can, and where possible, when it's deemed appropriate. Before I end this though, however, the tips I want to give you all to bear in mind and take on board with you is, number 1, some serious heart problems and thyroid problems can look like a panic attack, but not always the case. And as I said before, that certain, under diagnosing conditions such as these could cause it, but may not be able to. Number 2, make an appointment with your regular healthcare provider to rule out any other medical conditions that is, likely to interact with your panic attacks. Number 3, seek treatment for panic attacks sooner rather than later. Number 4, confide in a family member or a close friend, especially for those times when you really need them most for immediate support during the attack. Number 5, take good care of your body and mind. Eat a healthy diet, get enough rest, avoid beverages with high caffeine content, be physically active and routinely participate in activities you enjoy. Number 6, consider learning a new method of relaxation such as yoga, meditation, or mindfulness. Number 8, but last but not least, it's important to concentrate on your breathing rather than your unpleasant body sensations of that panic stage. It may seem hard to do, but because it will likely to feel like you're passing out. Breathing deeply and slowly, however, will relax you. Basically, that ends part 2 on how to stop a panic attack. Give me the like for thumbs up for support. Comment below if I've missed out anything. Feel free to subscribe to my channel if you haven't done so for more updates of what I'm going to be doing based on these and more. Feel free to share these videos around to family and friends so that we can create awareness together. Also, feel free to follow me on my social media sites, AspieAnswersAll on Twitter or Facebook. Feel free to just, comment below or just open up the channel for discussion for how you deal with this, and also that we can help create an awareness and understanding between us all. So with these guys, basically, thanks for the support, thanks for watching, do what you love what you do. Aspie signing out, and I'll see you again soon.